Chronic disease is especially interesting in a situation where we can't see patients face to face. There are challenges, but there are also opportunities. One of the nice opportunities with chronic disease management is because it's not addressing an acute problem, the actual physical exam part of the visit becomes less critical, and it's really focused on education and patient empowerment. So we can really focus on that a lot more with our patients. In the typical office encounter, when I see a patient with chronic disease, they have multiple chronic diseases, but they also have a bunch of other things going on. And we only have 15 minutes. So by the time we've addressed all of their acute problems, I run out of time. I can't empower them. I can't educate them. I can just barely make sure that they've gotten their medications refilled. So now in the setting of talking to them over the phone, I find that it's actually a much more intimate connection because we're really able to have a mutual conversation about a non-acute issue. So we're doing a lot more education, a lot more going through the medications, with a fine-tooth comb, making sure that they understand their lifestyle and their medications and how all of those things impact their health. What's really necessary in order to complete this picture is we need some feedback. We need data to know that these interventions are having an impact. So blood pressure is critical for a person who suffers from hypertension to know what their blood pressure is. It's been much easier for us adapting to treating diabetes over the telephone because most diabetics already have a home blood sugar monitor, but not so much for our hypertensives. A few of them have blood pressure monitors, which is great. I was on the phone with a patient just on Monday, and she has a horrible uncontrolled blood pressure. She has a history of an aortic aneurysm, so for her it's critical. We have to keep her systolic blood pressure under 120, and the last time I saw her, it was high and we had to send her to the ER, and I was like, I'm not going to be able to take care of this patient without sending her to the ER because she's just not amenable to over the phone care. But then she told me that she had a blood pressure cuff and she took it out of the box and we used it right with her at that moment over the phone. And she was able to tell me her blood pressure, which was not perfect, but it was not ER material. So we were able to keep her out of the emergency room because she had this monitor, but she's one of the few. In most cases, I'm begging patients to go out and purchase one if they can. They're $45. I've told them the one that Consumer Reports recommends if they can find it, but it's not ideal. We'd really like to keep patients at home. It would be perfect if everybody had a blood pressure monitor, just like they have their blood sugar monitor, and we could just check in with them weekly, bi-weekly, and make sure and reinforce the good care that they're taking of themselves. Just in terms of data collection, I think that there's data collection for chronic disease management. There's so much we could accomplish if we just have a blood sugar monitor, a blood pressure monitor, and a bathroom scale. So with those three pieces of information, we can keep them stable and healthy, and we can make it through until social distancing is over and they can come in and see us and get their labs drawn. The other thing that would be really helpful that we're working on building now is just making more educational materials available to them. We're putting things on our website. We can text them links to educational materials. So we're trying to build a library of resources for our patients. They actually have a little bit more free time now than usual because many of them are home. So kind of trying to redirect their energy to using this time to really focus on themselves and their health. So any resources for that would be appreciated. And then another big resource that is needed is anything to help them deal with the stress of the situation. So many of our patients are, their lives were tenuous to start with. They live in crowded housing, small, multiple family members. They can't self-isolate. They're already medically fragile. They're anxious. They've just lost their jobs. They're living, without any savings to start with. They don't know how they're going to pay the rent, or they have family members that can't afford to stop working, so they're still going out and they're worried about getting sick. It's stressful, and our behavioral health providers are overwhelmed. So So thinking also about just resources around relaxation and stress management and mindfulness, just something to help insomnia, cognitive behavioral therapy for insomnia, making those resources more widely available for patients to access from home, I think would go a long way to helping them stay healthy and manage their chronic diseases as well. How important I think home blood pressure monitoring is in general, and I think this has been overlooked, that I think that we have not been proactive enough in asking our patients to monitor their own blood pressures, and often I think because they're never measured unless they come to the office, and often when they come here their blood pressure is high, so they don't believe it. So they think either they don't have high blood pressure, just something happened on the way here, they were in a hurry, or they drank a Coke, or they didn't sleep well last night. So there's that. So we're underdiagnosing because the patients don't believe it, or we're overdiagnosing because it actually is white coat hypertension and they go home and their blood pressures are in fact normal. So I think if this period of increased access to telehealth, more monitoring from home, ushers us into an era where we do utilize home blood pressure monitoring more, I think that will have been for the good.